Hello everybody. Assalamualaikum and good afternoon. So before we introduce our next speaker, before we proceed with our next speaker, let me introduce him. We are not alien with Dr. Mumtaz. He served with UITM before. So bit background of his is he graduated with Bachelor Pharmacy degree from King's College, as well as a PhD in the same area from King's College, from the same institution. So Dr. Mumtaz also, we are glad to have him. He's also a member of Royal Pharmaceutical Society of Great Britain, registered pharmacist with UK General Pharmaceutical Council, as well as registered with Pharmacy Board of Malaysia. So he has the best of both worlds basically, and he served at several time points with UITM, USM, UKM, Faculty of Pharmacy, and then and now and also at various time points he served as a community pharmacist in the UK. And currently he works as a general store pharmacist with Boots Pharmacy UK. So I think we are glad to have him here today. So I think without further ado, let us welcome Dr. Mumtaz for his talk. Okay. Dr. Mumtaz, the floor is yours.
Thank you very much, Dr. Faiz, for the nice introduction. Okay, I hope you can see my slides.
Yes, we can see.
Okay, excellent. Thank you very much. Okay, so I just wanted to give really more of a kind of an overview of what it's like at the moment to be a pharmacist within the UK. I mean, I've been with Boots, the chemist, now for slightly more than a year now, and I joined Boots just before the UK went into lockdown, which was towards the end of March. And I think after we did actually go into lockdown, things changed quite substantially. So what I want to do is I just want to kind of give you sort of a very brief idea as to the day in the life of a pharmacist with Boots in the Whitgift Centre, which is a large pharmacy down in South London. So my first slide just sort of kind of gives you an overview of what I would do in an average day with Boots. So my day would usually start at 8 o'clock, and so Boots have a number of online systems, IT systems, that would allow patients to actually request their repeat medication. So normally the first thing that I would do at 8 o'clock in the morning is I would work through a lot of the online systems and actually send a lot of these repeat requests from patients over to surgeries. And so that normally will take about half an hour or so, because on average we would receive electronically about 40 to 50 repeat requests, and that's over and above the actual repeat request that we would receive in store. And I'm sort of talking about maybe about 100, 150 repeat requests that we will receive on average each day. And all of those normally would need to be sent out to the surgeries. Next steps would be to clinically check the vast number of electronic prescriptions that we received the evening before. Now, I mean, for those who may not be aware, doctors now in the UK, they don't issue handwritten prescriptions. The vast majority are now issued electronically, and those are then sent out to the pharmacy of choice. And so on average, we receive about 500 electronic prescriptions each day. So each of those they need to be checked in order to make sure that they are appropriate. Not only that, within the actual Whitgift Centre, not only do we have a walk-in pharmacy, we also have a pharmacy that caters specifically for a number of nursing homes that we dispense prescriptions for. So after we've sort of worked through the electronic prescriptions for our walk-in pharmacy, then we need to clinically check the prescription for our nursing homes, and we also need to check the mark sheets that we produce for each of those prescriptions. So that in itself is about an hour's worth of work in the morning. And then once that's done, then we normally receive our morning order so the prescriptions that we receive the evening before, they are actually processed electronically through our system, and the stock for those prescriptions then arrives the next day. So that normally has to be booked into our system, because what we have with Boots at the moment is an electronic inventory. So all stock that arrives has to be booked in, and that's added into the inventory. So what that means is that when we dispense a prescription and we dispense an item, then that item is then ordered automatically for the next day. Once that's done, then from 9 o'clock onwards, then what we need to do is check our store diary. So we have a diary normally associated with each Boots pharmacy, and that diary addresses a lot of the additional services that we offer as a pharmacy. So an example would be flu vaccinations, pneumonia vaccinations, Hpv vaccinations, and there are a number of travel vaccination services that we offer. So of course now I'm sure you've got the idea that the theme for a lot of the services, the additional services that we offer within our pharmacy, are vaccination services, and all of our vaccination services are delivered by a pharmacist. So the vast majority of the appointments that we see for our vaccinations occur in the morning. So on average, with regard to flu vaccinations, for instance, if it's a lucky day, normally we would see about 10 flu vaccinations on average. If we're unlucky, that can move up to about 30 vaccinations each day. And as you can imagine, most of our vaccination services, they need an extra pharmacist. I mean, it would be really practically impossible to actually run the actual day-to-day operations of the pharmacy in terms of dispensing prescriptions, as well as offering vaccination services. So once we work through the actual diary, store diary, then we can focus on the actual day-to-day tasks that we associate with our pharmacy. So in terms of dispensing, checking our dispensed prescriptions, handing out prescriptions. We had a number of addicts in our store, so dispensing methadone prescriptions for our addicts. Once the majority of our dispensing has been done, then it actually frees the pharmacist to actually spend time out on the counter, healthcare counter, responding to symptoms and advising. And of course, depending on your point of view, 5 o'clock is the best time of the day, which is home time. So what I want to do is kind of just give you an idea as to where we are with regard to pharmacy services within the UK. So I mean, of course, pharmacies within the UK are part of the primary care team, and in the UK that's referred to as the primary care network, the PCN. And so we have at the moment almost 12,000 pharmacies in England, and all in all, those pharmacies, they dispense on average about a billion prescription items every year. And I think that works out about 8,000 prescription items per pharmacy per year. But what I want to focus on a little bit more is the vaccination services, and more specifically flu vaccinations. Now, around 80% of those pharmacies within England also offer flu vaccinations. Now, the actual flu vaccination season within the UK runs from September up to about March, at the end of March. And last year, community pharmacies administered around almost 1.8 million flu vaccinations. And in terms of the actual perspective, just to give you some perspective, there are about almost 7,000 GP surgeries. So with the surgeries, the pharmacies, we administered all in all about 15 million vaccinations. Now, that's not enough. It's not enough. And I'll explain why. Because every year, the NHS, they offer 30 million free flu vaccinations to the public. Now, at the moment, there is a shortfall of about 15 million. And so the aim of basically pharmacies offering the actual flu vaccination services is to try and address this vaccination shortfall. So there are quite a substantial number of UK citizens who are at risk, the elderly, those who have underlying disorders, who are still not actually receiving their free flu vaccinations. So the aim of pharmacy is to try and address that gap. So as a service, of course, pharmacies are actually paid for each vaccination that we do administer, and the vast majority of those are on-site, and some pharmacies, they do also offer an off-site service, but what I want to focus on is the on-site services that the majority of pharmacies do operate at the moment. So with regard to pharmacies within the UK are considered as NHS contractors. So what that means is that pharmacies have a contract with the NHS, and that requires us to offer a number of services. So essential services and advanced services are mandatory. So essential services are what we would normally expect most pharmacies to offer within the UK, things like dispensing, of course, self-care, which is also known as responding to symptoms, the disposal of medicines. There's also a new discharge medicine service. So when a patient is discharged from a hospital, often the discharge summary that the patient receives from the hospital seems to go missing. And GPs within the community tend not to receive that information, and they don't prescribe accordingly. So pharmacies now are responsible in terms of being a go-between the hospital and the actual GP surgery to make sure that the information issued by hospitals upon discharge is communicated effectively to GP surgeries. Other essential services include health promotion. So community pharmacies are mandated to be part of 4 health promotion campaigns each year. Signposting, so which means that if somebody walks into a pharmacy and we can't help them, then we need to have sufficient information to actually refer them to the appropriate services. And of course, the advanced services. Now, what differentiates essential and advanced services is training. That's really important. So in order to offer advanced service, the pharmacists, they need to be trained, and they need to show that they are competent enough to offer those services. So at the moment, we have the CPCS, which are consultation services. So if a customer is referred by a GP, or if he's referred by NHS 111, so the pharmacist needs to be able to deal with that referral, either by prescribing something appropriate or providing the appropriate advice. There are, of course, the medicines use reviews, there's the new medicine service, and of course, the influenza vaccinations. So again, training is the key, and not only trained, pharmacists, they also need to prove they are competent. So essential and advanced services are mandatory. Advanced services are mandatory on the premise that the pharmacists have been trained. And then we also have part of the NHS contractual service are enhanced services. So these enhanced services are commissioned by the local health authority. And of course, what's really important at the moment are COVID vaccinations. So COVID vaccinations are enhanced services. What that means is that they're not mandatory, and they're not mandatory because not all pharmacies have the required infrastructure. Not all pharmacies have the required staff numbers to actually offer these services. So that's why the COVID vaccination services have been placed under enhanced services, because there is an understanding that not all pharmacies will have the actual physical infrastructure to be able to offer these services. So let's kind of talk a little bit more about the vaccination services, flu vaccination services. So as I mentioned, the aim with actually flu vaccination services is to maximize the uptake of flu vaccines, especially among those who are at risk, and to actually build the capacity of the NHS to actually try and reach that 30 million mark, which is the ultimate objective. And so what we want to do is provide opportunities for the public via an improved convenience. Patients can walk into pharmacies. They don't even need to book an appointment as they do with GP surgeries. And the GP surgeries, especially now during the pandemic, they are heavily oversubscribed. Often they are actually closed to the public. So the vast majority of GP consultations are done online. So patients cannot even see their GPs face to face. So pharmacies have remained open during the pandemic. And the actual flu vaccination service was offered right in the middle of the pandemic. And the fact that pharmacies were open, they were accessible, patients, customers, they didn't have to book any appointments. So the aim really is to improve the convenience for customers who are unable to book an appointment with their GP. They can just walk into a pharmacy, and if we can fit them in, we will fit them in. However, before any pharmacy can offer a vaccination service, any vaccination service, so there are a number of factors that they need to consider. Training, the physical infrastructure, in this case, the consultation room, the ability for pharmacies to communicate with GPs, because once a patient has been vaccinated, we need to actually communicate that fact to their GP surgery, and we need to update their records. So in the UK, we have what's called each patient has their GP records, or called the summary care records. And so we need to update their summary care records with the fact that they have been vaccinated. We need to keep those records within the pharmacy. So if a patient experiences a problem after they've left the pharmacy, a reaction of some sort, then we need to be able to quickly access those records so that we can match the vaccination with the batch of that vaccination. We also need to think about the legal considerations behind the vaccination service, and I'll mention that in my next slide. And of course, PPE. PPE in the UK over the last year or so has been quite hard to come by, and there has been a huge shortage. So that's an important consideration. So all pharmacy staff involved in the provision of a flu vaccination service, they need to receive the appropriate training. Not only that, that training needs to be updated on a regular basis. So with regard to pharmacists, they need to undergo a refresher training once a year, and they need to have a certificate renewed every year to actually prove that they are competent not only in the administration of vaccination, the safe administration of vaccination, but also with regard to basic life support, being able to identify what an anaphylactic reaction is, and also being able to administer first aid, adrenaline, both to adults and children after any such anaphylactic reaction. The immunization standards are set by NHS. It's a national standard, and the NHS sets a curriculum, a core curriculum, which all vaccination services, not only flu, need to abide by. But it's important to actually remember that the curriculum, the core curriculum for the vaccination standards doesn't just cover the practical training. It also tries to promote an understanding of what the vaccination programs are all about, the policies behind the UK vaccination services. And this is really important, especially in an age of anti-vaxxers, where social media does really sort of allow the public to disseminate misinformation. And so I think one important role of pharmacists, as Datin Mariani hinted, is that, you know, one important role of pharmacists not only is to vaccinate, but also to actually provide the public with up-to-date, relevant and accurate information regarding the vaccinations. And so that is part and parcel of the curriculum that the NHS requires pharmacists to undertake. So the actual training is important with regard to the practical side, in order to actually prevent errors during vaccine administration. And also it's there to actually promote consumer confidence within the vaccination service. I mean, I think the vast majority of pharmacists within the UK, we kind of pride ourselves in our technique, our vaccination technique. I mean, I've seen quite a few videos online. I've seen a lot of news reports online where healthcare practitioners are sort of demonstrating their vaccination technique. And I have to say, I mean, I don't, this is not something I say with any pride or any arrogance, but often I look at the techniques and I sometimes do sort of cringe a little bit, because I think pharmacists in the UK, we try to, as much as possible, to make sure that our techniques are impeccable. Because what we want to do is we want our customers to come back. What we want is our customers to encourage others to come to our pharmacy. And the way we can do that is to promote confidence with our abilities, not only in the practical side of administration, but also in our communication, to actually convince customers that they need to be vaccinated. So training, very quickly, the aim of training is to make sure that that vaccination practice and administration is safe and effective, is to make sure that we as healthcare professionals provide accurate and up-to-date information regarding the relevant diseases and vaccines for our patients. We also need to make sure that we support our patients to make an informed decision about vaccination. Now, we can't judge. I mean, everybody has the right to their opinion, but of course, it's important for us to actually impart a balanced view, a balanced kind of idea as to what the vaccination policies and what the actual vaccinations are. And then ultimately, it is the patient who needs to make up their mind. Either way, we are there to support. We are there to support. I mean, the actual training, the objectives are also, we also need to make sure that if we actually face any difficulties with regard to not only the physical side of the vaccination, but also with regard to advice, that we are able to seek advice, specialist advice, if and when required. And also the objectives of training is to make sure that we are confident with our administration, our storage, and also to make sure that we actually deliver an extremely high standard of care. So this is kind of a comprehensive idea as to the curriculum that's offered with regard to training. I don't really want to go through it in detail, but I want you to focus on the areas in red. So essentially, communication, that's very important. we need to be able to communicate to our patients, but we need to be able to communicate in a very non-judgmental way to actually provide a balanced view with regard to what vaccinations are, but ultimately let the patient make their own decision. We need to think about the legal aspects of immunization, and I'm going to speak about that in a little while. The storage and safe handling of vaccines, the correct administration of vaccines, and what anaphylaxis is, and how we would address an anaphylactic reaction. So with regard to vaccine technique, the vast majority, not all, but the vast majority of vaccines that we offer within Boots in our store are administered intramuscularly. So any training not only needs to factor in intramuscular administration, but also SC or subcutaneous administration. Vaccine techniques, I mean, normally with regard to flu vaccinations, 99% of our patients will be adults, but Boots also does offer flu vaccines to children above the age of 12. So therapeutic holding is also an important consideration, especially if you are administering to young children, and especially if you are offering other vaccination services. So for instance, in our pharmacy, we also offer HPV vaccinations. So HPV vaccination will be, I mean, often would involve younger children. Travel vaccination services, we would often involve younger children. So we need to be able to guide parents as to how they would hold their children. If a child is afraid, nervous, we need to be able to advise on the correct procedure with regard to therapeutic holding. Vaccine techniques also not only includes administration, but the safe handling, storage, and actually disposal of vaccines and used materials after administration. Surprisingly, needle stick injuries are extremely common within primary care. So for those of you who are not sure, needle stick injuries essentially are when a healthcare practitioner, after the administration of a vaccine, once the vaccine, the needle is removed from the patient, they inadvertently poke themselves with a used needle. So safe handling, safe storage, safe disposal of used material, really the aim there is to minimize needle stick injuries. So I have a very short video that I just want you to have a look at with regard to the vaccination technique.
So the first thing we're going to do is to landmark exactly where we're going to go for an intramuscular injection deltoid. So we use a deltoid because it's a really safe muscle to use, very little chance of hitting any blood vessels or nerves, and it's a really nice accessible muscle. So we want to make sure that our patient is wearing a top so that we can fully access the shoulder. So once we've got that, we've got the shoulder fully accessible, we want to be able to find the acromion process. That's the button right at the end of the shoulder, where the shoulder joint finishes. From that point, it's really important that we move away from the shoulder joint so that we don't inject into the shoulder joint. So we want to go down 2.5 centimetres in the midpoint from that position. So this is the area that we're going to be wanting to inject into. So in terms of injection technique, it's really important that we hold our syringe correctly. So we want to hold our syringe like a pen. Holding it like this gives it really good control. So when we're giving an intramuscular injection, we're going to be stretching the skin. So if I show you on the actual skin here, we'll be stretching it nicely here to make sure that we're going into the muscle. Helps desensitize the area as well. So I'm going to be injecting into the injection pad today. Holding the injection like a pen, we're going to remove the sheath at the last possible moment. stretching the skin. We're going to start as close as we can to the surface of the skin, and we're just going to quickly and confidently inject. We're then going to press the plunger nice and slowly, taking about 5 seconds to deliver that vaccine, if it's about 0.5 of a mil, and then quickly and confidently remove that needle. When it comes out, it goes straight into the sharp spin.
Thank you very much, Jaswa. Thank you very much, Jaswa, for that video. I hope you found that interesting. So if you, for those of you who are quite observant, if you notice within the actual video,
sorry, but you have to share again your slide.
Okay. Thank you very much, Jaswa, for that.
Okay, thank you.
So for those of you who are watching the video, so if you notice that, so the person who was administrating, the person who was being administered to, and the sharps bin. So that really was called a triangle. So what we want to do is try to make sure that once the needle has been removed from the patient, is as quickly as possible, it's actually placed within the sharps bin. So that triangle ensures that it's quickly removed from that triangle situation and is entered as quickly as possible into the sharps bin. And something else that actually I noticed within that video is that the administrator, she inserted the needle all the way into the patient. So of course she was using the pad, but she administered the needle all the way into the pad. So that's actually quite interesting, because worst case scenario, what may happen is that so you may have a breakage. So the needle may break away from the syringe. So if you insert the needle all the way into the patient and it breaks, it's very, very difficult for you to remove that broken needle. So often what I would actually tend to do is leave a small portion of the needle protruding from the patient. And in that way, if there is breakage, it's very easy for you to remove the needle. Okay, so moving on. So one other aspect of the actual training for pharmacists is basic life support. So it's important that we are able to identify what an anaphylactic reaction is, and of course how we would actually treat an anaphylactic reaction. And of course that will be done by the administration of adrenaline, so 500 micrograms for an adult every 5 to 15 minutes, and 300 micrograms for a child, again, every 5 to 15 minutes. And at the same time, we also need to be able to administer CPR and also be kind of well versed in the use of a electronic defibrillator. I mean, fortunately now, most shopping centres, most pharmacies within the UK have access to a electronic defibrillator. So if heaven forbid, we are ever faced with a situation where a patient does have an anaphylactic reaction, it's important the first thing we do before administering any sort of form of CPR or first aid is we call a member of staff and request that they reach out and bring forward a electronic defibrillator. That's very, very important. I mean, I've been very, very fortunate in that out of all the actual vaccinations I've administered over the years, I've never once had an anaphylactic reaction. I've never had to face an anaphylactic reaction, fortunately. The worst situation I've encountered is when I was administering to a husband and wife, and the wife, the actual lady, was quite confident, and I administered in her. And often what I would do is I would hold a conversation in order to try and attract attention away from the vaccination, and so the lady was quite happy. She never felt the actual needle prick at all. And I kind of sensed that her husband was a little bit nervous. He's a little bit jumpy. So I kind of took extra time in order to administer the vaccination to him. And I think about 15 minutes after the vaccination, I went back out, and because he was standing around in the pharmacy, and he fainted. He fainted. And my heart sank. And the reason my heart sank was the first thing that sort of comes to mind is anaphylactic reaction. And of course, you know, your mind is racing, your heart is beating, because the first thing you think of is basic life support training, CPR, you know, you have to administer adrenaline. But of course, my training meant that I was able to identify that he wasn't actually suffering from an anaphylactic reaction, because he kind of recovered quite quickly. And it happened that he was really nervous beforehand, and he fainted. I know I say he just fainted, but thankfully it wasn't an anaphylactic reaction. So something else that we need to actually think about before we do offer a consultation, before we do offer the vaccination services, is the consultation room. Now, I would say about 80 to 90% of pharmacies now in the UK, they do have a consultation room. But if you remember from my earlier slide, only about 80% of pharmacies do offer flu vaccination services. And one of the main reasons for that is, number one, is that they cannot meet the consultation room standards, and number two is they don't have sufficient manpower to offer vaccination services. So again, as I mentioned, most pharmacies, they need to have a consultation room. So this area needs to be kind of a confidential area, completely separate from the existing pharmacy, and it needs to be an area where the patient and the person administering the service can be seated and be able to communicate in a confidential manner. That's really important. So it's important that conversation cannot be overheard outside of the consultation room, and so it's a private area, needs to be comfortable as possible, and so the patient needs to have confidence in the room. It needs to be clean. It needs to have kind of a professional kind of feel to it, and we need to have sort of hand washing facilities within the consultation room, and it needs to be kind of an area where, if we need to access information sources, so there needs to be ideally kind of computer accessible within the consultation room, a computer where we can access the patient's medical records, and what I have is I've got some pictures of the consultation room that I was working with. But before I show you, it's important that within the consultation room we have a sharps bin and anaphylactic kit, and those had to be within the room at all times. So what that also means is that the consultation room needs to have a door that we can lock. And so let me just show you. So this is a picture of one corner of the consultation room that I was working with. As you can see, there's a sink in one corner, and there's access to hot water. We have a few leaflets on the wall, and I apologize because the image is slightly small, but there is a poster on one side of the wall which states that this is a safe space. And that's exactly what the consultation room should be. It is a safe, confidential space, and it's a space that patients should feel safe in using without any external hindrance. So this is the other side of my consultation room. So as you can see, there's a computer. So from this computer, I can access the patient's medical records. It's confidential, it's secure. So just beside the computer, there's a chair, and on the other side, there's another chair. So which means that, so one side the patient can sit, and on the other side, I can sit and I can administer my vaccinations. One other kind of important requirement of any vaccination service is that we need to be able to communicate with our GPs. So once a patient, so in this case, once a patient has been administered the flu vaccination, we need to inform the patient's GP, and that's the important requirement of the service. And so what we need to do is we need to be able to update the actual GP records, and those are referred to as summary care records. So pharmacists now within the community have the ability to access a patient's summary care records or SCRs in order to allow us to update what vaccination we've given, the time, the date, the vaccination, the batch number, and the expiry date of the vaccinations used. And the information systems that we use in order to achieve that are farm outcomes and sonar informatics. So in order to access those two systems, pharmacists in the UK, they need to have an NHS Care Identity Smart Card. So that's my smart card. It's rather an old picture. So we need this smart card in order to access the NHS network. So once we've linked into the NHS network, then we can access the patient's SCR or summary care records, and this allows us to directly update the actual patient's records. And also, if you remember, pharmacists are paid a fee to administer a vaccination, the flu vaccination. So this also allows us to claim or be reimbursed for the service. So as you can see on my summary care card, I have a sticker. So I have had my COVID vaccination. So that's worn with pride. So once we've administered the vaccination, before we administer, once we've administered, there are a number of records that we need to keep. First and foremost, we need to obtain consent. So this is usually written or verbal. So we ask the customer to sign a form that allows us to administer the vaccination. So that can be written or verbal. If it's verbal, then we need to update the patient's PMR medication, the patient's medication records, which we hold within the pharmacy. And we also operate a Chaperone Policy. So as you can imagine now, in this sort of the day and age, not only we as healthcare professionals, but patients, they need to protect themselves. So especially if we are using the consultation room on a one-to-one basis. So if we have a male pharmacist and a female patient, or a female pharmacist and a male patient, so we need to be able to protect not only ourselves, but the patient from harm. So we offer what's called a chaperone policy. And so we ask the patient before we go into the consultation room whether they would like to be accompanied. Some consultation rooms are rather small. We barely have room for 2 individuals, the pharmacist and the patient. But of course, we need to make sure that we do protect all parties involved. So the chaperone policy is a very important part of the vaccination service. Once we've obtained consent, then we need to ask the patients to fill in a national record form. So this applies to all vaccination services, be it flu, be it COVID. So this details the patient, the pharmacist, the vaccination, the batch number, the expiry date, and of course this flu record form we then use to update the PMR, the summary care records, and then we also use this to claim a reimbursement for the service. Now, what I really want to actually talk about is the actual legal considerations behind the vaccination service, because what you need to actually remember is we may be trained to administer a vaccination. However, the vaccination is it's a prescription item. It's a prescription only item. So in the UK, we have POMs, prescription only items. In Malaysia, of course, it will be considered Schedule B, only available on prescription. So what we need to ask ourselves is, what gives the pharmacist the authority to administer a prescription only vaccine? So this is obtained through either a national protocol, or usually what's called a patient group direction, a PGD. So the PGD allows healthcare professionals specified within the PGD to supply or administer a medicine, in this case a vaccination, directly to a patient without the actual need of a prescription. So what the actual PGD does, it authorizes us to administer a prescription only item. However, the healthcare professional working within that authorization, within that PGD, he or she is ultimately responsible for deciding whether a patient is suitable for a vaccination service. So the PGD gives us the authorization. However, the pharmacist still needs to decide whether the vaccination is appropriate. And that's important. That's really, really important, because it doesn't take the decision-making process away from the pharmacist. It just gives us the authorization. So that really fills the actual legality of the administration or the supply of a prescription-only item, because we do have other services within pharmacy that allows us to supply prescription-only items. So as an example, minoxidil, Propecia is a prescription-only medicine within the UK. However, working within a PGD, we can supply it. However, as pharmacists, we still need to decide whether to supply is appropriate. So that's really how PGDs work. So that's how the legality of vaccination services has been overcome within the UK system. So what I want to do is actually give you kind of a glimpse as to what a PGD looks like. So this is the first page of the patient group direction for the COVID-19 Pfizer vaccination. Now the front page is not really important. It just kind of gives you an overview of what the PGD is, which kind of drug, in this case, which vaccination it sort of operates under. But what I want you to do is look at the second page. So the actual second page outlines who developed the PGD. So if you have a look, the actual in this case, the COVID vaccine Pfizer PGD was developed by a pharmacist. So Elizabeth is the lead pharmacist for the immunization services for community pharmacy within Public Health England. So she essentially is really the head of the vaccination program within England. So she is the lead author for this PGD. So what it really should focus to you is that pharmacists have been really at the forefront of a lot of the vaccination services, and they have been instrumental in actually writing a lot of the legislation. They have been instrumental in writing a lot of the rules and regulations that we have to actually abide by. And I think that's really important, because pharmacists have really kind of integrated themselves quite well within sort of the public health system, within the primary care network within England, within the actual UK for that matter. And this kind of illustrates that. Something else I just want you to focus on is so what the actual PGD does, it authorizes a number of healthcare professionals to provide the vaccination service. So if you look on actually page 3 outlines the healthcare professionals outside of physicians, medical doctors, of course, who are legally allowed to offer vaccination services. So it goes from nurses, midwives, to pharmacists who are registered with the GPHC, to optometrists registered with the Optical Council. So all of these healthcare professionals are legally allowed under this PGD to administer a prescription-only vaccination. However, there are additional requirements. So if you have a look underneath, the additional requirements are specified. And of course, one major additional requirement is training. So the pharmacist, in this case, as I mentioned previously, they need to be trained, and they need to show that they are competent to offer the vaccination service. So that's really crucial. Okay, so I just want to kind of move on very, very quickly. So if you remember, one factor that we need to consider when we're offering vaccination services is the availability of PPE. So yes, for those who are observant, yes, that's me. I'm actually getting ready to administer a flu vaccination, and I took the opportunity, I took the photo opportunity. So I mean, PPE has been very difficult to come by within community pharmacy, and often we've had to source PPE ourselves. Thankfully, NHS England, within the last few months, they actually realised that PPE has been quite hard to come by because of the supply shortages, and because the government within the UK, they have been a little bit short-sighted with regard to PPE supply. So they weren't really sort of far-sighted enough to procure PPE. So thankfully, NHS England, over the last couple of months, they did open up the systems to allow community pharmacy to order from them. So initially last year, March, April, May, once the vaccination services started in September, we did have kind of problems obtaining PPE, but over the last couple of months that was addressed. So that's something that you do need to think about, because it's important that before every vaccination, your apron. So as you can see, I'm wearing an apron, I'm wearing a mask, I'm wearing a visor. So it's important that the apron is changed for each patient that you do administer the vaccination. The visor we can clean between each patient. The mask we can keep and change every day. But the apron is important that we change after each patient. So what I'm sure what actually a lot of you want to hear about is the COVID kind of vaccination services that we have been offering in the UK. So very quickly, I just want to mention that the UK, the crisis, it has been a substantial crisis within the UK. I mean, up until the 15th of March, unofficially 150,000 people have died as a result of COVID. And so what that means is almost 2,000 deaths per million population. And that's one of the highest in the world. And I feel, personally, I think one of the reasons for that is the rather lackluster response that the government has had as a result of COVID. Its response was late. I think the lockdowns were lifted far too early, and I think the response has been very inconsistent, and that inconsistency has led to the substantial loss of life. However, having said all of that, I mean, the restrictions are now being lifted again. So as we speak now, the outdoor, there was restrictions to meetings, outdoor meetings, and those were just lifted last week. And I think one of the reasons for the actual lifting of those restrictions is that the UK has been very, very quick in its vaccination service. So the vaccinations started at the end of last year. And I think it started because the UK was the first country in the world to approve the Pfizer vaccine. And I think one of the reasons why it approved it so quickly was the approval was granted outside of the EU, because normally most European countries, they wait for the EA. The EA is the European-wide medicines regulator. So the EU has been quite late with regard to approval. And the reason why a lot of the EU countries have been late is because they've been waiting for the EA, the European regulator. Whereas the MHRA, what they did at the end of last year was they granted batch by batch temporary approval for Pfizer vaccines. So that batch by batch approval meant that we could actually kind of start the vaccination process very quickly. And on the 8th of December, a 90-year-old lady was the first person in the world to actually receive the Pfizer vaccine jab. At the end of December, the Oxford was actually granted temporary approval, and just very recently in January, the US, the Moderna vaccine was the third vaccine to be approved within the UK. And in terms of the vaccination program, because I was kind of listening with interest with regard to the phases with regard to the actual Malaysian vaccination. So the UK vaccination so far has had 9 phases. So each phase has been dependent upon the risk factors for each of those among the phases. So the first phase, for example, was for residents within care homes, and so those above 85, and so those were deemed the most at risk. So those were within the first phase of the vaccination program, and this went on. Those in phase 2 was those over 80, frontliners, social care workers. Phase 3, those above 75, and so on, and then going down to phase 9, which is where we are at the moment, where all of those above 50 years and above. And so from phase 1 to phase 9, the population, that works out about half the UK population. So which means that at the moment, we currently half the UK population has been vaccinated, or I should say more accurately, half the UK population has received their first dose, COVID vaccine dose. I think in terms of second dose, approximately 3.5 million have received their second dose. So I kind of just very briefly, where are these vaccinations offered? So they are offered at around 300 hospital hubs in England, around 1,000 GP-led vaccination services, 300 community pharmacies, and around 151 mass vaccination centers. So these are large-scale kind of venues based around kind of football stadiums. So the aim really has been to try and vaccinate about 1,000 people a day as a minimum. But I think what's really interesting is that 300 community pharmacies are actively involved in the COVID vaccination program. So this kind of gives you an idea as to what a mass COVID vaccination center looks like. As you can see, we have individual booths. Each booth is manned by usually by a healthcare professional, 90% of the time a pharmacist. And kind of just to give you a larger idea as to what the venue kind of looks like. So you can see the booths, so you can see on the floor, there's the markings on the floor to make sure that social distancing is actually maintained. So these actually mass vaccination centers, as I mentioned, the aim is to try and vaccinate about 1,000 people at a time. So what's been happening with regard to the vaccination process is that patients have been approached by Public Health England individually, and once a patient has been approached, then they can book their appointment either directly with the hospital hubs or via online. And the online service has been actually a lot more flexible because it allows you to rebook your appointments. And not only that, it allows you to book within all of the actual venues that do offer the COVID vaccination services. So not only the hospital hubs, there's your 1,000 GP surgeries, but also the 300 pharmacies and the mass vaccination centers are all available to actually book within the online system. So what the aim is to try and maximize exposure to make sure that as many people can actually get hold of an appointment as quickly as possible. So once a patient has been vaccinated, then they would normally receive this vaccination card. So this is mine. So as you can see, I'm the proud recipient of both first and second of the Pfizer the mRNA dose. So this is basically serves as a record until if and when the UK can offer a passport system. So eventually the passport system kind of will open up travel within the EU. So this will serve as kind of as a stepping stone for the passport system. Now, very briefly, with regard to everything that we've actually talked about with regard to the flu vaccination, there are a number of other factors that we need to actually think about before a pharmacy can offer the flu vaccination service. And this is actually really important because we need to think about the suitability of the actual location. I mean, do we have easy access for our patients? I mean, in terms of parking, public transport links, disabled access, is there actually sufficient space available within your pharmacy to maintain social distancing? Because if you remember, with regard to actually flu vaccinations, we have the ability to control our appointments. And in that way, we can define the slots that we have for our patients. But with regard to the COVID vaccination service, what we want to do is try to maximize the number of people we are vaccinating on a daily basis. So what that means is that at any one moment, we can have 40 to 50 people within the venue at any one time. So what that means is that we need to have sufficient space to maintain that distance. We need to have sufficient space to make sure that entry and exit within, to and out of the venue is easy. We need to make sure that signage is sufficient, it's clearly marked into and out of. Also, what's really important is that once a patient has been administered, we need to have a separate area to make sure that the patients can sit for 15 minutes and be observed. And after that 15 minutes, they can leave. So hence, that's possibly, that explains why only 300 pharmacies are able to offer the service, because we need to make sure we have maximum space, and we need to be able to observe patients once they've left the the vaccination. Now, so that's thinking about the pharmacy. We also need to think about the actual day-to-day responsibilities, because remember, pharmacies are contractors. So, and as part of that contractual service, we still need to dispense. We still need to offer essential services. We still need to offer advanced services. So not only do we have to offer the services that we do as part of our NHS contract, we also now are offering vaccination, COVID vaccinations. So we need to think about our existing services. We need to think about the risk assessments that we've actually currently undertaken, because most pharmacies, they need to undertake a risk assessment. Most pharmacies, they have standard operating procedures. So we need to update our risk assessments. We need to update our standard operating procedures to actually factor in the COVID vaccination service. We are, after all, a business, and all businesses have an action plan. And that action plan is something that we kind of goes hand in hand with our NHS contract. So what we need to do is we need to update our business action plan, because we still need to offer dispensing services. And we need to make sure that our dispensing services go on unhindered. So what that means ultimately is staff. So do we have sufficient staff? Do we have sufficient pharmacists to be able to offer the services? And of course, storage space for the vaccines. We need to update our infection control. So we need to make sure that our routines, our kind of cleaning rotas are updated for our vaccine protocols, to make sure we clean before we offer. At the end of the day, we have to make sure we clean before and after each patient, after each administration. So we need to update our rotas. And as I mentioned previously, we need to have a clear understanding of the legal route that we have at our disposal. So I'm thinking about the PGDs, the patient group directives that we have at our disposal. We need to make sure that they are signed, that we understand what they mean, and that we abide by them. So I mentioned REV staff, so we need to make sure that we have sufficient staff over and above our normal dispensing services. We need to make sure our staff workload is appropriate, because we are, after all, healthcare professionals, and we need to make sure that all of our colleagues are working in a safe environment. So, and that means that we need to ensure that our colleagues are working within an environment that's safe, their workload is appropriate, and it's as such that we minimize errors, dispensing errors. Of course, we need to actually think about our vaccine storage, our protocols. We need fridge wastage, vaccine wastage, disposal at the end of our vaccination processes, and of course our IT infrastructure. So that's really all I want to talk about with regard to actually the COVID. I know it's been rushed, but it just kind of gives you an overview as to what actually pharmacists really need to think about with regard to vaccination services. But what I want to very, very quickly kind of touch on is anti-vaxxers. And I know it was kind of touched upon very briefly by Datin Mariani in her talk. So anti-vaxxers. So if you remember, with regard to actually training, part and parcel of training for vaccination services not only involves technique, but it also involves communication. So are we able to communicate effectively what vaccinations are, what the actual disease state we're trying to address, how important vaccinations are, how they work, and something I should mention is, so the Pharmacists Defence Association is an organisation in the UK that is responsible for providing pharmacists indemnity insurance. So as a pharmacist, in order for us to practice, we need to actually take out indemnity insurance. So what that means is that if um, heaven forbid, we are involved in a dispensing error, if heaven forbid, we are involved in a vaccination administration error, the Pharmacists Defence Association has lawyers who will work in our defence and to kind of protect our interests. So we, as pharmacists, we need to make sure that we do have this indemnity insurance in place before not only we practice as pharmacists, but before we administer vaccination services. So the PDA very recently introduced a campaign to encourage vaccination uptake, especially among the Black, Asian and minority ethnic communities within the UK. I'm sure you've heard of the expression BAME. BAME is an expression to kind of outline the Black and Asian ethnic minorities. And so those, it's been found that those communities, and I'm actually part of those communities, have been particularly at risk. And we are seen to be have a much lower intake compared with the white British population. So I can show you this graphic. I mean, I'm not sure if this is clear, but right at the bottom, the actual in grey, 91% of the white British population have been vaccinated against COVID. 91%. In red, only 58% of the Black African community, the Black British African community, had been vaccinated against COVID-19. So as you can see, the actual discrepancy is quite large. So there are a number of reasons for that, which I don't want to go into at this stage, but the actual campaign that PDA has introduced is to try and address this imbalance. So what I want to do is kind of just very quickly share a video. So Chair Azwa would share a video regarding the campaign. So it's a very short video, so please have a look.
Hi, my name is Dorothy. I am a pharmacist and I have had my COVID vaccine. Please make sure to get yours too, as it will help to keep you from
Thank you, Chair Azwa. So it's a campaign that actually does kind of echo what Dr. Mariani was talking about, in that pharmacists have been vaccinated. And I think that this is the first time, because of the COVID vaccination, that pharmacists have been considered as frontliners. And that's why we have been vaccinated. So those who have been vaccinated now are starting to actually speak out, and they're encouraging others to actually to get vaccinated. So pharmacists up and down the country have been actually posting these videos on YouTube to encourage those from the BAME community to actually get vaccinated. And I should end this kind of presentation with a very, very short video from Boots the Chemist. So Boots was one of the first organizations to offer COVID vaccinations in the community. So there was a large kind of vaccination center in Halifax. So if I can, I'm going to try and share a video from the pharmacist, from the head pharmacist in charge of this vaccination center in Halifax. So I'm going to try and share with you. So bear with me, please, for one moment while I do that. So actually, Chair Azwa, would you allow me to share the video? Thank you so much.
All the information is given on a physical. They will be given a full card, which will provide them with the details of the vaccine that they've received, and will be asked to bring that back on their second vaccination. They'll also be given some information leaflets about the vaccine and any side effects and takeaways that they need to read afterwards. After the customer has had their vaccination, they'll be directed out here. So if they need to have a rest period, then we've got plenty of seating along each side, but they can take a seat and it can be observed by our immunisation assistants. The whole team is very excited to be part of a first for Boots. So we will be the first vaccination clinic that Boots are opening by the Boots Store in the UK. We've had a day where we've brought the team together in small groups to experience what it's going to be like on the day, so that we've had a run through the customer journey, so the team are able to ask any questions and get familiar with the role that they're going to play in this clinic itself, and we're all ready to go.
Okay, actually, I'm really sorry. I think the video was quite poor. I mean, the audio lags. So what I'll do is I'll share a link, a web link for the video, so you can listen to it. I mean, kind of just kind of give you a recap. What the actual focus was the video. The focus for the video was space. The fact that the venue had sufficient space to actually meet and greet patients, more than one patient at a time. That venue was secluded, it was confidential, there was a one-to-one interaction between the pharmacist and the patient, and that one-to-one interaction allowed the pharmacist to give more information, any required leaflets if necessary. So the space within that venue allowed the pharmacist to reconstitute. And of course, if you remember when I talked about the triage, the triangle, patient, pharmacist, administrator, and the sharps bin. So that space allowed the triage, the triangle where the pharmacist could administer and then very, very quickly dispose of the needle within the sharps bin. And then once the administration is done, then the patient, if you remember from the video, then the patient is then moved to the next room within the venue where there were those blue chairs. Do you remember those kind of separated blue chairs? So that allowed the patients to sort of sit for 15 minutes and be observed. And then once that observation was done, they could leave the venue. So I think I have, yes, what I'll do is I will share a link with you within the chat. So there's the link. And I think that brings, I apologize, I did go over time a little while, so I do apologize for that. And that brings this session to an end. Thank you very much indeed for your kind attention.
Thank you, Dr. Mumtaz. It was, to me, it's an eye-opener actually for us. We rarely got any insight, detailed insights on how the practice in the retail pharmacy in the UK. I think obviously this is where we should head to for our country, and I think within these regions. So we received quite a lot of questions, Dr. Mumtaz. So I've divided the questions into two sections. One is a comparison actually between or just general information about the UK pharmacy. The first question is that what is the difference between the UK registered pharmacies when compared to Malaysian registered pharmacies? This is in terms of community pharmacies. So your comment on that.
Oh, you mean in terms of
practice? Our scope,
actual services that within the community.
Yeah.
I suppose. I think I'm quite fortunate in that I'm also actually registered in Malaysia, and I think having spent kind of some time in sort of the community pharmacies in Malaysia, I think well, one sort of key aspect really is dispensing. And I think, I mean, a lot of what we do in the UK now has kind of come off that dispensing process. And I think it all started with dispensing. And I think through dispensing, I mean, dispensing allowed us sort of to establish close relationships with GPs. It allowed us to establish close relationships with Public Health England. And I think via the actually being able to dispense, then actually came all the other services that we offer. In terms of medicine, because if you remember, I mentioned we have the essential and the advanced services. The essential services consists of really everything that you would expect a pharmacy to do. You know, dispensing, advising patients, accepting medicines, that unused medicines that have been returned from the public. But I think, and the advanced services kind of so they expand a lot of the essential services. So I mean, from dispensing, we have patient records, patient medication records, and then from patient medication records, we have an advanced services called the medicines use reviews. So what we do is we sit down with patients, we go through their medications, and to decide whether or not they're effective, appropriate, whether the patients are experiencing any adverse effects, and if we do discover any problems, any abnormalities, then those we can report back to surgeries. So I think a lot of those essential services have kind of allowed us to establish the very kind of relationships that have then allowed us to offer a lot of these advanced services. Because now if you're a member of the GPHC, so that really is kind of the bottom level. The bottom level is you're a member of the GPHC. So you can now, so if you look at the website for the General Pharmaceutical Council, if you look at the individual records, so for instance, you can search my name, or you can search my registration number, and so you have my GPHC number, and you can search for other pharmacists, and they will have an annotation against the name as being either supplementary prescribers or independent prescribers. So with regard to supplementary prescribers is you're a pharmacist that you can work within a GP surgery, and what that means is that the GP would make the initial diagnosis. So your GP would make the initial diagnosis and would make the initial would write the initial prescription. Say, for instance, you have a patient who has say hypertension. So then the doctor would write the initial prescription for the antihypertensive. And after a few days, after a couple of weeks, the patient will come back, and rather than see the GP, they would see the supplementary prescriber, who would be a pharmacist. And then so if there is any alteration required, the pharmacist would then issue any subsequent prescriptions. Okay. And then we also have the independent prescribers. So independent prescribers, again, they're pharmacists, they're members of the GPHC. However, they can write prescriptions independently of prescribers. So what that means is that a GP, for instance, would make a diagnosis, say a patient is hypertensive. Then at that point onwards, any prescribing would be the responsibility of the independent prescriber. So I think it's just that it's important that we do establish a really kind of close relationship with kind of the medical profession. You know, we really do have to work with them, and you know, and we have to show that we can work with them, and we can kind of we can alleviate some of their workload, and that's what we've done in the UK. You know, in terms of the flu vaccinations, COVID vaccinations, the actual referral services. So there are a lot of referral services, CPCS referral services, where GP, they refer patients to pharmacies. So what that means is that rather than see the patient within the GP practice, the GP refers them directly to the pharmacy. So I think because of dispensing, kind of we kind of opened ourselves up to a lot of these extra services. But ultimately, I think it's important that we show that we can work with the medical profession, and we can work to alleviate their kind of stresses and strains.
Okay, so this means that a registered pharmacist is just one type, I mean, a basic, and then they can move their career forward with
Absolutely, absolutely. Yes, absolutely. It is a stepping stone, because now actually, what we remember, I talked about the primary care networks, Well, in NHS England now, the NHS England is now divided into primary care networks, PCNs. And within each PCN, there's about 10 or 11 pharmacies. And each actually PCN has about, I think there's about 6 GP surgeries within each PCN. And each GP surgery employs a pharmacist, a clinical pharmacist. And their responsibilities are really to actually deal with patients and customers and actually write prescriptions. So yes, absolutely. Pharmacy, community pharmacy is kind of a stepping stone to
more developed,
so many other things. Yes. Yes.
So we have to move quite fast because we have a lot of questions, Dr. Mumtaz. So in terms of level of trust and confidence of the UK community to get the vaccination from the community pharmacy,
okay,
how can you say that? How you see it during your practice times?
Oh, I have to say, I mean, in terms of the actual response, I mean, for instance, with regard to actually flu vaccinations, I mean, pharmacists are now kind of considered. I mean, in terms of my impression with regard to the feedback I get from the actual surgeries that we work with and the patients that come into our pharmacy, we are seen on par with actually GP surgeries with regard to the actual professionalism that we do offer, and the patients, they don't have any kind of any apprehension or kind of qualms to come into pharmacies. If anything, patients, they expect it now. They expect to actually be able to come in to a pharmacy and be vaccinated. And it's quite interesting you mentioned, because when Boots first announced that they were offering COVID vaccinations, there was only about 3 or 4 centres in the UK that were offering the service, but we were receiving actually customers walking in. Yes, I'd like my COVID vaccination, please. And we had to explain to them that when only a handful of pharmacies are offering the service at the moment. So yes, absolutely. I mean, for patients, they do have the confidence in pharmacists to be able to offer, these additional services. Yes.
Okay. How about you think community pharmacy in Malaysia, whether they are ready to be a vaccinator to play a role?
Absolutely. I think, I mean, the pharmacy degree in Malaysia is one of the hardest I've ever experienced. I mean, yes, I mean, I used to, in terms of just, of course, I wasn't on the receiving end. I was actually teaching a lot of material, but I mean, having experienced actually UK, education system, I mean, the actual Malaysian pharmacy degree is extremely tough. And I mean, my impression is that the graduates, the pharmacy graduates, are extremely capable. And I think that they can do anything that's actually thrown at them. I just feel that pharmacists in Malaysia just need to be given the opportunity, to actually prove themselves. But no, absolutely, I think pharmacists in Malaysia are ready. Absolutely.
It's good to hear. I mean, the other question is that about the ADR and adverse drug reaction and medication error reporting. in the UK by the
Yes.
community pharmacy?
I mean,
You
the
do
thing is,
so.
I mean, it's an open system. I mean, ADRs now in the UK, it is an open system. So actually, anybody, be they be a healthcare professional or a lay member of the public, anybody can report an adverse drug reaction. I mean, it's done online. It's much easier now because it's actually done online. I mean, a few years ago, I mean, I'm talking about 20 odd years ago. At the back of the BNF, there was a yellow form at the back of the BNF. So, so essentially what that meant was it was only really something that a healthcare a professional was able to do. You know, make an adverse drug reaction, be it a standard adverse reaction or a black triangle suspected reaction. But now, because it's moved online, actually anybody can report a reaction, and that's really important because it's not our job to actually differentiate what's important and what's not important, or to establish a link between what is an ADR and what isn't. There are kind of experts there to actually decide that, as long as we actually report it, and we can. So it's open to everybody. It is open to everyone.
Okay, now we are going to the questions of UK pharmacies and the vaccination, I think.
Okay.
A hot topic for now. So, other than the COVID and influenza vaccines, what are the vaccines that UK pharmacies is doing now, normally give the patients?
Actually, I mean, in terms of NHS, there are only a handful of actually vaccinations that the NHS offer anyway. Flu is one of them. COVID now is another. But I mean, the majority of pharmacies now offer travel vaccination services. Travel services, I should say. So I mean, starting with anti-malarials. So if you're traveling abroad and you need malarials, anti-malarials, unfortunately, a lot of anti-malarials are still prescription only. So there are PGDs, the patient group directives in place that allow pharmacists to supply prescription only anti-malarials over the counter, which is good. So they're not only anti-malarials, but any issue to travel vaccination services. So in our store, we are offering hepatitis A, hepatitis B, meningitis, diphtheria, tetanus, typhoid, yellow fever.
So
Also,
basically, all the vaccines.
HPV, anything and everything. Yeah, because a lot of them were private. It's a private service because then they're not really offered under the NHS. Because even if you were to ask your GP for a travel vaccination, it would be it's something that you would have to pay for. It would something you would have to pay for. So pharmacies are actually free to offer any of these vaccinations because it is a private service. So yes, in answer to your question, anything and everything, as long as there is a PGD available, as long as the pharmacist is allowed, has the legal authority to supply the prescription only vaccine or medicine, then we can offer the service. Yes. However, having said that, if we can't, if there isn't a PGD available, Boots has a number of independent prescribers available. So if there isn't a PGD available, we can actually we can ask the Boots independent prescribers to write a prescription for us. So there are kind of ways around the legality with regard to supplying prescription only items. So yes, everything and anything that a GP can offer, pharmacies can offer.
So in terms of numbers of vaccine, how many your pharmacy? I mean, the capacity of your pharmacy to provide vaccine in terms of
In terms of flu vaccinations. So I was fortunate in that I had a second pharmacist because I mean I have to admit the pharmacy that I've been working in, it was busy, and it would have been really difficult to offer vaccination services as well as a lot of the other essential services that we expected to offer. So I was lucky that we had a second pharmacist, and in terms of the actual diary, the store diary that we had, it was open from 9:30 until 5 o'clock in the afternoon, and I had 15-minute slots. So so realistically, the most I actually vaccinated at any one time was about 30 patients, 30 flu vaccines in one day, and that was tough. That was difficult.
That's a lot.
That was difficult. I think because we had a very small, it's a small pharmacy. Even though we're busy, it is actually relatively small, and we only have the one consultation room, so I can only vaccinate one person at a time. Yes, unfortunately. So 30 is the most I vaccinated at any one time. And that was tough. That was exhausting.
It changes the PPE as well from patient to patient, isn't it?
Yes, exactly.
Yeah.
Because we do expect kind of the patients to actually hang around for about 15 minutes after the vaccination to actually make sure that there isn't, any reaction, any anaphylactic reaction. But the worst I've ever encountered is a patient fainting. Thank goodness. But that's the worst I've ever encountered.
Okay, so I think the hottest question is adverse effect from the vaccinations and COVID that you observe. In the UK.
Yes.
Yeah. So what are the most?
Okay. In terms of what I've seen, in terms of actually what I've read, and also in terms of the actual reports that I've seen from coming back from a lot of the boots pharmacists who are involved in the vaccination service, nobody has directly observed an ADR, an adverse drug event from the COVID vaccine. Of course, there have been kind of actually localized reactions to the vaccination at the site. People have felt unwell. I mean, I felt unwell after my second dose. After my first dose, I had a slight kind of irritation at the site of the vaccine. After my second dose, I should have stayed at home because I had a fever. I wasn't able to lift my arm, but I still went to work. But that's the worst I've actually come across, and I haven't seen. I mean, and the UK has been actually administering both the Pfizer vaccine and also the Oxford vaccine. So up until now, there hasn't been any sort of any major kind of adverse event surrounding any of those two vaccinations. So far, so good. So far, so good.
Okay. Okay. So I think last two questions that I have. One is the incidence of sharp injuries among community pharmacies
Yes.
vaccinations, and how the community pharmacies mechanism to make it to protect the community pharmacies.
Oh, absolutely. I mean, first and foremost, training, and then training. That's crucial. I mean, that's one of the reasons why we have kind of an annual refresher course, and pharmacists. So they need to prove that they are competent enough to actually administer vaccination. Part and parcel of that administration is that triage and make sure that needle sticking injuries are kept to a minimum. But of course, it does happen, and I think I mean, a pharmacist in my store was also involved in a needle stick injury. So there are SOPs in place regarding actually needle stick injuries. So first and foremost, thinking about the SOPs in place. So the pharmacists, they do need to kind of isolate actually themselves actually straight away. So they do need to make sure that they are tested for HIV specifically. So in our store, it was for HIV. So if you're being administered COVID vaccination, then of course you will need to undergo an RT-PCR, a reverse transcriptase PCR test to actually eliminate COVID as well. So HIV is the main concern for actually a lot of actually needle stick injuries, and that is kind of specified specifically within the SOP. So once the actual results are back regarding HIV, unfortunately, within the needle stick injury that I was involved with, the pharmacist was actually clear. Her result back were negative, HIV negative, and so she was actually free to resume work. However, she was actually free to resume work minus vaccination services. So she had to re-undergo training. So she had to be trained again, and she had to be reissued with a certificate to actually to ensure she was competent to administer. So that's the key there. So we need to isolate the patient, in this case pharmacist, to make sure that they are tested for kind of any untoward conditions, and once they're clear, then they need to be retrained. So that really kind of goes with regard to the SOP.
Okay, thank you. So I think last question, in terms of a body to audit the service of vaccination, is there any how the country audit the standard procedure, and how often they come and check the community pharmacy?
I mean, in terms of pharmacies, I mean, I have to be honest, fortunately, I've not been kind of directly involved in a vaccination audit. And I think that there isn't, as such, there isn't really kind of a mechanism in place that allows an auditor to audit the administration process. I mean, but there are kind of systems in place that allows an auditor to make sure that the processes, the PGDs are being followed, that the SOPs are being actually being followed. But in that case, the auditors are from the pharmaceutical company, in this case Boots, rather than any external auditors. So Boots. So the senior pharmacist from Boots would come and actually audit the processes that we have in place, but they wouldn't audit the actual administration process, because of course you understand there are kind of a lot of confidentiality issues surrounding the administration process itself. So with regard to administration, usually what would happen is, when you are first actually signed off as competent, then what you would do is your first 6 or 7 kind of administrations would be actually witnessed by an experienced pharmacist. So once that experienced pharmacist is happy with your kind of your method of administration, then ultimately you'll be actually signed off as being competent. But as far as the actual auditing system is in place, it's not for the administration as such, but it's for the processes, the PGD, the patient group direction, to make sure that's being followed, to make sure the SOPs are being followed, to make sure the pharmacy is being cleaned effectively, to make sure you have sufficient sharps bins, to make sure that the bins are being collected on a regular basis, to make sure that the pharmacy staff are sufficient, to make sure the consultation room standards are appropriate. So really the auditor kind of focuses on those areas, and those auditors are from the company rather than an NHS auditor.
Okay, so I think we exceed our time already. Thank you so much, Dr. Mumtaz.
So much.
I think it's very valuable for us. We should have more sessions for I think better understanding and that we can benefit from the view, from the practice from the UK. So
Thank you so much.
thank you. With that, I return back to our host, Abihab. Thank you.